So one of the issues with CAR T cell therapy is that it's a living drug. It's the currently FDA-approved CAR T cell therapies take a patient's own T cells and then genetically engineer them through a manufacturing process to turn their patient's T cells into CAR T cells. And this process is generally effective. Most of the major manufacturers can successfully do this in 80 to 90% of patients. However, sometimes the product that they get at the end is so-called out of specification, or may not be up to the manufacturing standards that the FDA has suggested are important for CAR T cell therapy. And so some studies have come out now looking at the efficacy of these out of specification products. Do they perform better or worse than the standard product when it's approved due to manufacturing specifications being in specification? And it's a bit, small numbers, but, for example, an abstract coming out about axicabtagene ciloleucel that's out of specification, it does seem that there's a slightly lower CAR T cell expansion and a slightly lower efficacy when these cells are out of specification. For Kymriah, for the Novartis product, they have a higher rate of out of specification products, partially due to the way that they were calculating the viability of these cells that I think is now being approved. But it did overall seem that the results of those out of specification products were comparable to the standard Kymriah product. However, whenever there's an out of specification product, it creates a lot of anxiety for a patient. You're undergoing this potentially life-saving therapy. You really want your therapy to be 100% of what it should be. You don't want to hear that it is maybe 70% of what it should be or anything else. And so we thought on our end, while as an academic medical center, we don't have any control over the manufacturing process, we do have a control over some of the prior steps. And one of those steps is the apheresis process that we use to take out the patient's own T cells. And so in the study being presented at ASH, we looked at some of the characteristics that associated with whether or not an in-specification product was being generated for the Novartis product, Kymriah in particular, because they provided a lot of really interesting information about their products. And so what we found is that when we did the apheresis on these patients, interestingly, patients who had a low body weight or were smaller tended to more often have out-of-specification products. And we're going to use this information to hopefully optimize our practices, perhaps keeping patients who are smaller on the machine a little bit longer to see if we can't get more patients into that specification range.